Hello everyone, my name is Gail and I'm a researcher here at Clinic Kids, and today we're going to be discussing a treatment for depression in autistic young people. So we already know that autistic young people experience mental health concerns at a much higher rate than the general population and are twice as likely to experience depression compared to their non-autistic peers. And while we know that psychotherapy remains a leading evidence-based strategy for managing depression symptoms, the efficacy of such approaches in autistic young people remains limited at the moment. And one of the reasons for this might be in how these programs are designed and whether or not aspects of the programs may be suitable for neurodivergent young people. So the study that we've linked at looks at an autism-adapted, neurodiversity-affirming cognitive behavioural therapy program that was developed with the autistic community. So the researchers wanted to understand whether this program could be delivered in young people and whether the program may reduce depression symptoms like difficulties with emotion regulation and self-esteem. So the researchers delivered the 12-week program to groups to 24 autistic young people, so children and adolescents aged between 11 and 17 years of age. At the end of the program, the researchers found that most youth were able to really complete the program, and those who did complete reported high satisfaction in the program. Amongst young people and their caregivers, most reported that the program was beneficial, and that the most beneficial parts were the in-session discussions and affirmations of autistic identity and the opportunity to engage with other autistic young people. The program also indicated some improvements in depression-like symptoms like emotional reactivity and self-esteem at the end of the 12-week program, suggesting that it might be promising in addressing depression symptoms. However, we really need now future research with a comparison group or a control group to test this effect more rigorously to actually understand whether these gains could be maintained in the long term. Importantly, the researchers comprehensively monitored the participants and didn't observe any significant harms or adverse effects for young people participating in the program. So overall, this research is an important step towards developing autism-specific programs to address mental health concerns for autistic children and young people, and supports the need for further research and clinical practice in neurodiversity-affirming mental health care practices.